So our patient today has chronic left maxillary sinusitis. She's failed multiple courses of antibiotics and medications and continues to have a left-sided maxillary sinus infection that's persistent. We did a CAT scan that showed significant infection just in that left maxillary sinus, and she's here today to have a balloon sinuplasty done in the office to drain the sinus, to open up the natural hole and make it wide so it can easily flow and not cause any more problems for her.
We can see on this CAT scan that this patient has opacification or obstruction of the left maxillary sinus. As you can see in this picture, on the right side the sinus is black, which means air-filled. On the left side where the arrow sits, the sinus is filled with gray, which usually implies fluid or soft tissue, in this case fluid being pus. So the balloon sinuplasty procedure we're doing today will entail 4 steps. The first step is that we're going to insert the balloon system and the guide wire into the nasal cavity and insert the guide wire into the left maxillary sinus, as you can see in this picture, step 1. Then we're going to thread the balloon over the guide wire and suspend the balloon at the level of the sinus opening, as you can see in step 2. When it's there, we will dilate the balloon and thus open up the natural sinus hole to approximately 6 millimeters, and follow this up with retracting and removing the balloon, and then just simply irrigating the sinus with saline and suction in the area. And then in step 4, we're going to remove the entire balloon system, and the patient will go home with a wide open sinus that's now free of pus. We're inside the sinus, and you can see that the left maxillary sinus is illuminated and the balloon is inside the sinus. So right now the guide wire is inside the left maxillary sinus, and you can see the sinus illuminated, and now we're passing the balloon over the guide wire to dilate the sinus.
So we just finished the balloon sinuplasty. She did fantastic. We were able to open up the sinus opening that was closed and actually scarred closed because of the infection, and we were able to wash out a fair amount of purulence that's been sitting there for more than 6 months and failed numerous antibiotics. She's going to go home with some Tylenol and some nasal rinses with saline, and hopefully have a complete and speedy recovery.